A major shift in healthcare could be on the horizon. The Trump administration now reportedly planning to launch a pilot program covering popular weight loss drugs like Ozempic and Wegovy for Medicare and Medicaid recipients. The 5-year test would begin as early as next year, pairing medication with lifestyle coaching for select patients. But not everyone's on board. Health Secretary Robert F. Kennedy Jr. warning the drugs are costly and should never replace diet and exercise. NewsNation's Hannah Brandt live in Washington, D.C. Hannah, this is a big deal because so many people are trying to get their hands on these drugs. What does the pilot program look like?
Laura, certainly a lot of people would be interested in this potential program. The Trump administration, as you said, considering a pilot program, and it's important to emphasize that would allow government insurance to cover weight loss drugs like Ozempic and Mounjaro. Now, that's all according to reporting from the Washington Post, which says it obtained documents outlining plans for Medicare and Medicaid to cover those drugs starting as early as next year. GLP-1 drugs like Ozempic have become wildly popular over the last few years. I think we all know that. And clinical trials do show that they can be very effective in helping people lose body weight. But they come at a high cost. Those without insurance pay an average of $1,000 a month for the drugs. And this potential move would be a significant reversal from the Trump administration, which had previously rejected a Biden administration proposal to cover the drugs under Medicare. Now, that Biden plan was estimated to come with a $35 billion price tag for taxpayers over 10 years. But some medical experts argue that cost would be worth it because patients who lose weight with the drugs are then less likely to need expensive treatments from health complications later. And we know obesity can cause much higher risk for things like strokes and heart attacks. And right now, about 40% of adults in the U.S. are considered obese. At least 13 states currently in their Medicaid programs in the U.S. do already cover GLP-1 medications for obesity treatment, Laura.
All right, Hannah, thank you very much. I understand that Secretary Kennedy has raised concerns about cost and, over-reliance. So how much pushback is there within the administration on this? It sounds like they've got a good fight ahead of them.
Yeah, there are some mixed messages that we're seeing from Trump administration officials about these drugs. Secretary Kennedy has been really critical of weight loss drugs in the past, suggesting in various different interviews that Americans should focus on diet and exercise to tackle obesity above all else. But then Dr. Oz, who does lead the Centers for Medicare and Medicaid Services, has promoted GLP-1s, those drugs like Ozempic, saying in a 2023 post that Ozempic and similar drugs can be a, quote, big help to those looking to lose weight. Now, it's important to note CMS has not officially announced this policy and has actually declined to comment on the Washington Post's reporting about any potential new coverage, Laura.
All right, we'll see where it goes from here. NewsNation's Hannah Brandt, thank you very much for joining us today.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.